Good evening. So, direct retainers are actually a component of your RPD only. Okay, your clasp, right? The clasp one that actually comes under your direct retainer. The term suggests it. Direct retainer, retention. That's a compound which is going to give some kind of retention. That is a direct retainer. Directly, it is going to give some kind of retention. That's it. Okay, to prevent the dislodgement of the processes that you are going to put. This is your direct retainer. You know what it is. This is your clasp. That is your direct retainer. Now you have a lot of varieties, a lot of classifications which comes under this. You can have extracoronal ones. You can have intracoronal ones. Okay. Now, when it comes to exams, you will never get a question from intracoronal ones. Okay, you'll only get questions from this extracoronal one, which is the most important one. If you see your question paper, you can see it. Okay, the most of the questions will be write something about extracoronal or write about the factors that are affecting these things. Intracoronal is not at all asked. The intracoronal is just that there are some attachments only. As a term suggests, they are intracoronal. Intracoronal means what? You have a crown, okay, you have a tooth. Suppose this is your abutment tooth, okay, suppose this is your abutment tooth. You will actually prepare in your abutment tooth at the same time the one that you are going to put, okay, whatever it is, you are going to put a crown or you're going to put a processes, whatever it is, you will have an extension like this. So this will come and lock inside this. That is your intracoronal. Okay, you're just locking. That is your intracoronal, attaching, direct attachment. Okay, so when you talk about this intracoronal, we usually say it's like you have matrix, you have something which is known as matrix. Okay, matrix, we actually call matrix as a male component and the female component is the matrix. So we join the female and the male component to get this attachment, and so this will give the retention. This is how we actually talk about this intracoronal direct retainers. We have a lot of varieties of this intracoronal direct retainers also. Like we can have internal, we can have external, we have stud, we have bar, we have special, but this is not at all important. We're coming to the important part. What is the extracoronal direct retainers? Okay, so this is a part of the RPD which will actually help to directly retain or directly stabilize the complete partial denture framework. Okay, this can actually contact or it can actually encircle the complete teeth. We'll see the complete encirclement. We will also see what it comes to this contact bit. We'll see that. So, as a whole, extracoronal direct retainers act like this. Okay, they will stabilize. They will stabilize. See, this small thing with the very small clasp is going to stabilize. They're going to retain the complete processes. So that is the importance of this direct retainers. Okay, now when we talk about this extracoronal direct retainer, we know the clasp is the most important thing here, and clasp is the hero here. Okay, so when we talk about the position of this clasp placement, we always say that we have to place the clasp. Okay, see, this is your height of contour. Suppose this is the height of contour. Now you know how to do the height of contour. We have seen the surveying things. So we know what is the height of contour. We know what are survey lines also. So when we place the clasp, okay, when you place a clasp, it is very important that the clasp should always be located below this. Okay, if it is below this height of contour, it means that it is in the undercut region, right? Below the height of contour, it's undercut region. The height of contour is the bulged area. Just below that, you are having that undercut. So this clasp should always be present in this undercut area. So what happens? You are going to eat something like a very sticky one, a very sticky chocolate you are going to have. Okay, the patient, you are having this processes, the RPD processes, and you are just trying to have a very sticky chocolate. Okay, if your clasp is somewhere here, when you start chewing, this processes will come out. But when your clasp is here, for your full processes to come out, this clasp have to move along all this bulge area. Then only it can come out, right? Because there is a bulge. This bulge, it has to overpass because this is here. This is in the undercut area. You have placed a clasp in the undercut area. Now, when you try to put it out with this kind of sticky foot or any kind of dislodging forces, small dislodging forces like that, this has to go like this. Now, that is an effort. So that is importance. That's why we always place our clasp arm below this undercut region. I mean below this height of contour in the undercut region, so that it will be in a better position and this dislodging forces can't pull it out. Okay, that's a very important thing about the clasp placement. Now, when we talk about this, okay, when we talk about this, the whole tooth, okay, you can actually divide the whole tooth as two cones, as you can see in this figure. You can actually divide it like this. Okay, this is one cone, and the lower one is the other cone. Okay, and this the line which separates the upper and the lower cone, you can call it as your height of cone. So this is actually a theory. This is known as Protheros cone theory. Okay, there will not be any question like that. This is just for understanding things. But still, if when you are writing an essay, you have to include this also. So we can actually divide the whole tooth into two cones like this. Okay, upper cone, lower cone, and they two meet at a single plane line, and that line is your what? That line is the height of cone. Okay, both these lines actually meet at the height of cone. So what he actually called the line, that the area of the tooth that is above to this line is known as the suprabulge, and the area which is below is known as infrabulge. Okay, the area which is above this height of condyle, we can call it as suprabulge, surface which is occlusal to the height of condyle, and the area which is below, you can call it as infrabulge area, that is surface which is below to the height of condyle. Okay, now when you have a clasp arm, okay, when you have a clasp, you are going to place a clasp, and when that clasp actually ends below, okay, when a clasp tip that ends below the junction of these two cones, see, this is the junction of these two cones. Okay, so this is one cone and this is the other cone. Okay, see, if this is your clasp, if it ends below the junction of these two cones, this will resist the movement in the upward direction, because definitely it has to deform if it want to move out, right? This is a bulge, so if you want to pull it out, it has to deform. Okay, with your finger pressure you can definitely pull it out, but for your masticatory pressure or your sticky foot pressure, okay, this will not happen, and that's our aim also. Okay, now you have given a process to the patient, and the patient really wants it when he is eating food, or when he is having some chocolates, and all those times he wants that process to be inside his mouth. Okay, so that stability, that retention is very important for every patient. So that's the reason why we have to place the clasp arm below this height of condyle or the junction of these two cones. Very important. Otherwise, the whole thing will be a failure because it will move out. So when it is below this junction, what happens? It has to re-deform. When it wants to move out, it has to deform because you have a bulge there. So that is the ideology behind this, the clasp placement. Now when you talk about this clasp is having these many components. As you can see in your screen, these many components are there in your clasp. Starting from a rest. You have a rest, you have a shoulder, you have a body, then it is connected to the minor connector wall, then you have a retentive arm, then there is a retentive terminal, then you have a reciprocal arm. These all are the component parts of your clasp assembly. This is another picture which is showing that. Okay, these are the important components of your clasp assembly starting from the rest. Now you know what is rest. Okay, the same rest that we have seen in the last class can be occlusal, it can be lingual, it can be incisive. And this actually resists the tissue bone movement of the clasp, that's it. The same rest. Now the other things are different. Now you are having something which is known as retentive arm. You are having something which is known as reciprocal arm. Very important things. Okay, now this is body. Body connects this rest. Okay, this body is actually connecting the rest and shoulder to minor connector. Rest and shoulder to the minor connector. That is what the body does. Now the shoulder one connects body to the clasp terminals. See, this is a cross section. That's the reason. So that is how the connection goes. Now that's not that important thing, but the retentive arm and the reciprocal arm are really important. Now when we talk about this retentive arm, see, this is the retentive arm, or this is the retentive arm, or this is the retentive arm. Okay, the whole retentive arm, you can actually divide it into two. See, two colors are there, right? This is one part, this is another part. Okay, this end tip, this tip one is known as retentive clasp terminal, and this part is known as retentive clasp arm. So you can actually divide the complete retentive arm into two. One is retentive arm terminal, the terminal end, and retentive clasp arm. Now the important thing is that this part, the retentive terminal part, this is flexible. That is the important thing. Okay. Retentive terminal part is the flexible part. Okay, this is the only flexible part. Nothing else is flexible. The only flexible part of your complete assembly is your retentive terminal. You have to study that. Okay, retentive terminal is the only flexible part, and this one, okay, this the other part is not flexible. The only part which is flexible is retentive terminal. Okay, now this is the terminal. This is the body. Retentive class part. This is retentive terminal, and this part, this dark part, is the only flexible part. Now, why this part is flexible? Why do you want to make a single thing as a flexible and a non-flexible one? You make this part is flexible just to make it pass through this bulge area. I have told you, so when you're placing a clasp, you have to overcome this bulge area, right? Now you just consider a very big metal piece and you are trying to pull it down, it will not move. You need a very little flexibility so as to pull it down. Right, very small flexibility. That is your retentive terminal. That's the only flexible part. Okay, and that is the only part that is going below this height of contour. Just see this figure. This retentive terminal is the only part that is going below this height of contour, and that is the only part which is flexible. It is made flexible just to make it bypass this height of contour. That's it. Okay, the other part, this part is not flexible. Only this part is flexible. Just to make it pass through that bulge area, you have that flexible part. The other part is not flexible. Okay, now you can think, okay, if you have this part as flexible, now this is a flexible thing. Now you are having some food and anything, food and something, this can come out, right? That's a question that can arise in your mind. Right, this is a flexible thing. Now you are going to have an eclair or something like that, very sticky chocolate. Now what happens? This can come out because this is flexible. Even if it is a bulge area, this is flexible, this can come out. This is a normal question that can come. But for that, what we have is, we have something which is known as reciprocal arm. That's the reason why we are having this reciprocal arm. Okay, this is located in the opposite side. Just the opposite side of the tooth, you are having another person reciprocal arm to counteract the forces. To counteract the forces of this retentive arm, you are having this reciprocal arm. That is the reason you are having this reciprocal arm. Now this retentive arm, definitely it is going to give some forces because that's a flexible component. So when it goes around, when it moves and all, there is some kind of forces that is going to happen. This force is counteract by the reciprocal arm. That is going to stabilize this. So both of them, the retentive arm, reciprocal arm, together help in this complete retention. So that is your retentive arm and reciprocal arm. Very important. Should I repeat? Should I repeat? Hello? Am I audible?
Yes, ma'am. You're audible, ma'am.
Should I repeat?
No, ma'am.
Is it fine?
Yes, ma'am.
Okay. We have the very important thing, requirements of the class. We have some factors. Okay, we have state retention stability support, something that we are studying from the CD thing, same thing. Again, we have retention stability support. Now we have something which is new here, that is reciprocation. Just because you are having your reciprocal arm, the same thing we have to study, reciprocation, encirclement, passivity. These all are the requirements of the class. This can actually come as a separate essay question also. Again, very important thing. Now, retention, the definition is the same thing. The same thing. We are studying the retention, stability, support, definition. Right? The rest is the force of gravity, are the same as referred, the forces that are associated with objects. The same GPT definition you can write here. And this is the most important function of the class. To provide the retention, this is the most important function. See, obviously, right? Why do you place this class? For retention. For retention is the most important function. Obviously, yes. Now you have some factors that actually affect this retention. There are many factors that is going to affect this retention, something that is going to improve retention, something that is going to destroy this retention. Yeah, of course. One by one. What is known as retentive undercut? See, this is a tooth. Now this is your height of contour. Okay, now you can draw a line like this. Okay, you can draw a line like this, a vertical line and a horizontal line like this. Okay, you have a vertical line and you have a horizontal line. Okay, and in between that, okay, this horizontal line is the height of contour only, and then you can draw a vertical line, and in between you will get an angle. Okay, see this x here also, this x, this is an angle. So this angle is very important. Okay, this angle is very important. This angle is known as angle of gingival convergence. This angle is having a name. The name is angle of gingival convergence. This is the angle that is formed by this height of contour and this vertical line. Now what happens is, as you can see in this picture, see the angle. This angle, when you compare it with this angle, see this angle is less, this angle is more. When you compare, okay, when you compare, see this is a very small angle and comparatively this is more. So what it says is, okay, according to the theory, according to the concept, what it says is, when you have the angle less, okay, when you have a less angle like this, greater is the distance between the height of contour and the retentive tip, which means, see, you are going to place a clasp. Okay, see, here you are going to place a clasp. The clasp will be like this. See, this is undercut, right? It will end here. This will be the retentive tip. But here what happens? See, where is undercut? This is undercut. Now from the height of contour, see, this is height of contour. See how it has to go. Just compare these two pictures. Here, see, this is undercut. So you can stop your retentive terminal here. See here, where is undercut? This is undercut. So this has to move more. The retentive terminal will end somewhere here. Right? When the retentive terminal ends somewhere here, look the length of the clasp. The clasp length increases, which means when the angle decreases, greater is the distance between the height of contour and the retentive tip. This distance increases in order to provide the retention. Now what happens when the length of the clasp arm increases? Flexibility also increases. You want much more flexibility. You don't want more flexibility. Now that will affect the retention. That is the concept. You see, when you have a lengthier thing, okay, lengthier metal, when you compare it, this will be more and more flexible. Flexibility really increases. Now, when you have a very big flexible thing, retention will definitely be compromised. Now, that is the first factor. So, see, this is the next thing. The same thing that we have said. You can actually write it as a second point also. The distance between the height of contour and the retentive tip. Same thing. Okay, that will affect the flexibility. Same thing. Now this is the next thing. See, if this distance, this is a terminal one and this is your height of contour. Now this distance, if this distance is more, okay, if this distance is more, that will also increase the flexibility. Now flexibility is again a problem. We don't want much more flexibility. Okay, now that's it. Then what? We will say directly about the flexibility. Now what happens is when you have a much lengthier clasp arm, what happens is flexibility will definitely be compromised. Okay, more flexible, more length, more flexible. Okay, if it is more flexible, the stress will be less, but retention will be very much less. Okay, when you have a flexible thing, the stress that the abutment or the tooth is going to get will be less. Obviously, it will be less, but our aim is to provide retention, right? That retention will not be there. Increased flexibility, retention will be less, but stress will be less. If the stress is less, that is advantageous to the abutment teeth or your teeth, but our aim is not satisfied, our aim is not fulfilled here. That's a problem. Now, when we talk about the diameter, okay, this is a common sense thing. See, you have a metal. If the metal is having increased diameter, if it is a thicker metal, obviously flexibility will be less, right? A metal wire having much more diameter, okay, which means it's the thicker one. If it is having much thicker, means what? Flexibility will definitely be less. That will not be flexible. It will be really hard. So that's a diameter. So If diameter is more, flexibility will be less. That is inversely proportional one. So that's it. Now, when we talk about the class material, we have different materials, right? When we talk about this class materials, if it is a wrought wire, it will be having more flexibility than when we compare it with the cast alloys. The wrought metals will be having more flexibility. Okay, that is the flexibility things. Now, when we talk about the class type of the class, okay, we will see this all kind of clasp now. But when we talk about this gingivally approaching clasp, we will see this gingivally approaching clasp. But still, this gingivally approaching clasp have more retention than this occlusally approaching clasp. We will see that. We will see what is this gingivally approaching clasp in next slides. Now, stability. What is stability? Quality of a denture to be firm, steady, constant. Okay, to resist the displacement, not to subject to the change of the position when the forces are applied. That's the stability. Right, all the class components except the retentive terminal. Now you know why. Okay, retentive terminal is a flexible thing. That small part, that's a flexible thing. So that will not help in stability. Except that retentive terminal part, all the other parts of your clasp is going to help in the stability. That's a stability, to be stable there. That's a stability. Now, support means what? To hold up, to serve as a foundation of prop. That's it. It's a support one. Okay, to resist the displacement of the processes towards the underlying structures. You will place for that. What do you place? Place rest for that to get the support. If you don't have rest, what happens? It will move towards the basal tissues, right? To your mucosa, to your gingiva, it will move. When you chew, it will move. During mastication, it will move. So that can result in many other problems. So support is important there. Then this is reciprocation. Now you know what is reciprocation also. I told you what is reciprocation because you are having a retentive arm. The retentive arm is having a part which is known as retentive terminal. This retentive terminal is what? Retentive terminal is flexible. Now there is a kind of force that is going to be generated from this retentive terminal. There are kind of lateral forces that are going to be generated from this retentive terminal when it passes through this height of condor. Now this is counterbalanced by the reciprocal arm. That is a reciprocation of the forces. Okay, which means one part of the process is made to counteract the effect that is created by another one. Okay, one is making some problems in order to prevent bigger problems that can be resulted from this. The other one will actually sacrifice or will bear all these kind of forces and stresses, and that will help in the complete stability. So that's a reciprocation thing. Now you have encirclement. Okay, encirclement. Encirclement means what? Encircle, to encircle, as you can see, encircle. The property of the clasp assembly to encompass more than 180 degree of the abutment teeth. Okay, to circle, to encircle. It can be continuously or it can be like a broken content. Okay, if you have a complete encirclement like this, what happens? More stability, right? It will not move because surface area, the area, this metal thing or the clasp that is touching to the tooth is very much more, so that you will have more retention. That's an encirclement. Okay, now this encirclement is actually provided by your retentive terminal, your rest, your reciprocal arm, all helps in this. There's an encirclement. Then you have passivity. Passivity means what? Okay, passivity means the condition of inactivity assumed by teeth, tissues or denture when an RPD is in place but not under masticatory pressure. It means, okay, you have given a processor to the patient. You have given all this kind of clasp to the patient. Okay, now when the patient is not doing anything, okay, the patient is in a very rest manner, these things should not work, right? You don't want any kind of forces that is going to act there. So that is passivity. That's the inactivity phase. When the RPD is not having any kind of masticatory load, when the patient is in complete rest, we don't want any kind of these forces that is going to act on this patient's abutment teeth. So that is a passivity. Now what happens is if the clasp is not seated properly, if the patient, you have delivered a RPD to a patient, now the patient while putting the RPD, what happened is the clasp was not seated properly. Now if something like that happens, what happens? Continuous forces it will be. Okay, even at rest, this will be going to deliver a lot of force to the abutment teeth of this patient. Now what happens then? Definitely pain and tenderness of the teeth. So we don't want our teeth to be in complete function every time. The abutment teeth to have all of 24/7 having all this kind of load. We don't want that. Okay, when there is a masticatory load, we want everything, all the things that we have studied to act there. But when it is in rest, it should be in a passive mind, in a passivity state, inactive state. So that's a passivity. Now when we talk about this clasp, you have something which is known as C clasp, the circumferential clasp, the accursed clasp. Now this C clasp, we divide it into 8 ones, like symbol circlet, we'll see each one. 8 clasps are there. You have something which is known as combination clasp also. Then you have the other clasp type which is known as bar clasp, vertical projection clasp or roast clasp. These are the different types of clasp, 2 types of clasp. And in that you are having many subdivisions. Okay, see, C clasp, circumferential clasp, means this is going to encircle the tooth. Okay, this is going to encircle the tooth more than 180 degree. More than 180 degree it is going to circle the tooth. Okay, this is how it is going to encircle the tooth. Now this is, its basic form consists of what? It will be having a retentive arm, it will be having a reciprocal arm. From a common body it will be coming, it is having a wrist. This is how it looks like. This is a circumferential clasp. Okay. Now the clasp, circumferential clasp, is also known as accursed clasp. Okay. In that you are having 2 types. You are having something which is known as combination clasp, and you are having something which is known as clasp circumferential clasp. You see clasp circumferential clasp first, then we will go to the combination clasp. So this is clasp circumferential clasp. This is also known as accursed clasp. Okay, if you see a question like accursed clasp for 2 marks, okay, blindly right? This is C clasp only. So clasp circumferential clasp means what? Every component is made up of what? Clasp metal. That's the reason why you call it as clasp circumferential clasp. Now, when you talk about it, the same concept that we have studied in the last slides. The retentive terminal should originate above the height of contour and to terminate below the height of contour. Okay, it should be below the height of contour, your terminal. It will originate above the height of contour, it will terminate below the height of contour. Definitely yes. The terminal should be below the height of contour. Then only that will resist the dislodgement. Now, retentive terminal should always point towards the occlusal. Okay, this is how it should look like. It should not be like this. Okay, looking down. It should not look down. It should always look up. This is how it should be. And this should actually go and terminate in the mesial or the distal line angle. This is how you want your C clasp to be. The design of the C clasp to be. Now you have different types of circumferential clasp, starting from the symbol circlet clasp, as you can see in this picture. Okay, see, this is the first type of clasp, circumferential clasp, or C clasp. This is not a symbol circlet clasp. This, see, this is edentulous space. You have an abutment teeth here. Okay, this is not a distal extension gauge because you are having a posterior teeth also. So, what happens here is the clasp actually starts from the edentulous space, near the edentulous space. From the edentulous space, it will start. And it will move towards the edentulous space. Here you are having teeth. Okay, from the edentulous space, it is going to start. Approaches here, there will be the undercut, right? So this actually starts from the edentulous space, approaches the undercut from the edentulous space, and it will go and get inside this undercut. You cannot use it in a distal extension space. Okay, see, the same thing. If the patient is not having this teeth, okay, you are going to put this kind of clasp. What happens? Now, if the patient bites, the complete thing will go up. So you can't use it in a distal extension case. Only when you are having this posterior teeth, then only you will place this symbol circlet clasp. So the important thing that you need to know about this is it starts from the from near the edentulous space, and it will engage the undercut in the opposite side. This is how it is. This is a symbol circlet.